Yes, sorry for the interruption. So we will come back to the subject. So an autoimmune disorder occurs when the body's immune system attacks and destroys healthy body tissues by mistake. There are more than 80 types of autoimmune diseases, and the number is going on getting added. So normally the immune system, which guards against germs like bacteria, viruses, when it sends these foreign invaders, it sends an army of fighter cells to attack them. It is nothing but a defensive system. We are all having this, and most of the time we are least bothered about these things because everything is happening automatically. But one thing you have to understand, this is a very complex system. Body has to recognize only these invaders as invaders, and they have to send and attack that a particular bacteria or virus. So there are some signal systems running in the body to say that I am part of you, don't attack me. We have different types of cells, we have different types of tissues. Everything should recognize as a part of your own body. Then only this attacking of unknowingly, mistakenly attacking will not be happening. Body has to recognize this in a right way. So this is a complex system. So we will see how this complex system is working. Little bit we will go to that. Normally, the immune system can tell the difference between foreign cells and your own cells. I was telling there is a signal saying that there may be like a flag. I'm saying I am a Croatian, I am a Serbian. So similarly, there are cells chemically indicating that I am not, I am part of you. Please don't attack me. So this system is, there are different types of tissues. This is running very smoothly. Certain time it is failing. In case of autoimmune disease, the immune system mistakes the part of your own body, likes your joints or skin as a foreign, and it relapses proteins called autoantibodies that attacks the healthy tissues. This leads to a psoriasis, this leads to interstitial lung disease, this leads to rheumatoid arthritis. This is what happening. So we will see in the next slide how these things are. Some of the autoimmune diseases which you may be knowing by name, ulcerative colitis are there, which affects the intestine, and which organ it is affecting is also very important when you look from an Ayurvedic perspective also. Because multiple sclerosis, where it is affecting the vital organs, then the chances of the negative effect of this impact of this autoimmune disease will be very severe. Whereas you get more time if it is affecting joints or if it is affecting your intestine like ulcerative colitis, you have time to do a preventive and corrective action. Whereas if it all of a sudden affects the immune system, all of a sudden if it is affect the central nervous system, then the impact is severe. The damage which happens to the neurons cannot be reversed. Whereas the damage which happens to the joints up to certain extent, it can be revised. So the importance of which organ or which system is getting affected also very important about this autoimmune disease. So you know ankylosing spondylitis, you know scleroderma, Addison's disease, Graves' disease, which affects the thyroid, psoriasis, rheumatoid arthritis, which are becoming more and more common even in my own clinic. So these are some examples. So here I'm using a guard dog to explain what exactly the immune system is, how exactly the immune system is functioning. So you have a good dog, good guard dog, not your pet I'm talking. I know I have seen many in Zagreb city. People are walking with the 2 dogs, 3 dogs. So this is not the dog I'm talking. This is a guard dog I'm talking. So the immune system is like a guard dog that protects your body against threats. Like it will not allow any trespassers to come inside and attack you. So that is the right way the immune system has to function. Whereas in case of hypersensitivity, that is very common in Croatia and other parts of Europe, I know. the pollens and the dust and the smoke. Hypersensitivity is a very serious problem there. Sometimes the immune system may overreact and attack things that aren't inherently harmful. So it is attacking your own front. It is not allowing your friend to come inside to your house. The guard dog is attacking. Even though it is a minor issue, your hypersensitivity is creating problem which are very common. And for example, chronic rhinitis, urticaria, all coming under that, which we will see in the future. And here another called immunodeficiency. Your immune system is not functioning appropriately. A dog is dead. Sometimes the immune system stops working, rendering the body defenseless. Dog is dead. So that situation comes under AIDS, HIV. This is the situation. Immune system is not at all functioning. And when it comes to the autoimmune system, today's our subject. It's a bad dog. It is attacking the owner. Sometimes the immune system might fail to recognize the difference between the friend and foe. Dog attacks owner. So your own tissue is getting attacked by your own defensive system. So there are exact causes are yet to known fully. We are all having a partial idea how this is happening. But normally if you take, when you have autoimmune disorder, your immune system does not distinguish between healthy tissue and potentially harmful antigens. As a result, the body sets off a reaction that destroys the normal tissue, which I already explained. I think this is very self-explanatory. You understand this. And what are the results of these autoimmune diseases? That can destruct your body tissues. Chronic rheumatoid arthritis will totally spoil your joint and it is becoming osteoarthrosis. Abdominal growth of some organs, changes in organ function, your function also getting deranged. Normally it affects the organs or tissues like blood vessels. You have vasculitis and connective tissues, which is very common in the joints. Rheumatoid arthritis, seronegative arthritis, psoriatic arthritis are some of the examples of this. And it can affect endocrine glands such as thyroid or pancreas, very common Hashimoto's thyroiditis. It can affect joints, muscles, red blood cells, skin, scleroderma, psoriasis, all very common. And some of the immunological diseases which we are successfully treating in our Ayurvedic hospital here in Avian, Madurai, South India, they are Hashimoto's thyroiditis, psoriasis, eczemas, alopecia, contact dermatitis, ulcerative colitis, multiple sclerosis, MS, rheumatic diseases like seronegative arthritis, which is very, very successful, and rheumatoid arthritis. Ankylosing spondylitis, I have thousands of cases I've treated, and I can assure that if we are able to diagnose this ankylosing spondylitis in the beginning stage, we can reverse. You need not have to take lifelong medication. Ayurvedic treatment and Panchakarma could be able to totally reverse this ankylosing spondylitis. And SLE, serum lupus erythematosus, little bit tough. Not that easy. You may require an allopathy or the modern medicine doctor's help also then and there, but we can have a very good supportive role in that also. And some of the other immunological diseases are like frequent infection, maybe respiratory infections, chronic urinary tract infections, which we are able to very successfully treat. And some of the hypersensitivity like allergic rhinitis, bronchitis, asthma, urticaria is very commonly which we are coming across, and we are able to help those people in a very well manner. And some of the investigations which need not be that useful for you, maybe CRP, ESR. I think this slide is not that. So now I come to my main part. How does this Ayurveda look into this? The ancient science of life, at least 3,000 of documented evidence of survival, that itself is showing how deep this is. The fundamental principles of Ayurveda till this date unbeatable. it is still practically used, and many people are getting a benefit out of this science, even though it has been as old as 3000 or 4000 years of recorded evidences. So that is the beauty. Even we know, whatever we know from the modern science, whatever it is older 25 years cannot be used now. That is a ever changing science. That is also good. I'm not against to that, but the depth of the fundamentals of Ayurveda is totally unbeatable. So we believe in Panchabhuta, Tridoshas and Saptadhatu, which I explained you with this simple slide. I'm sorry that this I have to explain in a very nutshell manner, because this is a very elaborate subject which can be discussed for maybe months together. So I'm just summarizing this. I think few of at least will be having fundamentals of Ayurveda. If you are not so familiar with this, I can just brief. There are 5 gross elements. We in Indian tradition, we believe that the entire cosmos is built up with these 5 elements, which most of you are familiar. Prithvi, in Sanskrit, Prithvi is earth. And next is Jala, which is water. Then comes fire, Agni. Then comes air, it is Vayu. Then ether or space, that is Akasha. So every object, including us, are made out of these 5 Buddhas. And we are in a dynamic scenario. Every time we are all changing. Ayurveda is not something which is very compartmentalized knowledge, which we believe in dynamism. Every now and then it is changing. So even homeostasis, the internal environment also, we don't believe. There is a word called stasis. Stasis is something which is stationary. We believe that body is like a running river. Every time it is changing. Morning there are some properties. That properties is changing by noon. Then by evening that property is again changing. So you drink something, you eat something, you have some emotional stress. Everything involving this change. So there are 7 tissues. These 5 elements, which I already discussed you, to a structural functional unit called Dhatu. We call it the Dhatu. Dhatu is made out of these 5 elements, but there are 7 types of tissues in the body, which are frequently undergoing a change depending on all the factors, external and internal. So this change is making us to explain as Vata, Pitta and Kapha. 5 elements is becoming 7 tissues all the time. So in this exchange, we consider Vata is like a, so you know, the matter is all the time getting released as an energy. That's what our life. So matter, which is, we have conservative energy, that is called Kapha. So the fuel for the fire to burn, that is Kapha. And the fire element, which transforms, the transformal energy is called as Pitta. And the utilization energy, what we are utilizing in a channelized way, is called Vata. So this, if you are really asking me, this Vata, Pitta, Kapha is existing? No. This is existing as a change. Every time it's changing. So Vata, we consider this Vata in these tissues as some of the properties like dryness, lightness, all the group of qualities bannered under Vata is certain category. Group of qualities bannered under Pitta is like hot, sharp, all things comes under Pitta. And Kapha, oily, and something which is Guru and stable, heavy and stable, is considered under Kapha. So group of the qualities attributed to these 7 tissues are coming under these 3 headings. So just for the understanding I am making you, 5 elements are made out, the 7 tissues are made out of 5 elements. Transformation is happening like a running river. So you are understanding in a living organism as Vata, Pitta and Kapha, even though it is the same Buddha. So here comes another concept. In these tissues, if these doshas or something which is having a tendency to get vitiated, that is called dosha, or the humors, are deeply seated. Like I'm giving you an example here. These doshas would merge with the dhatus, like you have seed and soil. Seed is already there in the soils, maybe years together, but it required water, it required the environmental and the seasonal favorability to sprout. Similarly, tissues these 7 tissues deeply, these doshas can get hidden inside. So that develop into a disease only when there is a situation comes favorable to that. So you may be having a hidden seed sitting inside you. Here I'm coming to explain the autoimmune disease. Autoimmune is not happening accidentally. People, those who are having this hidden seed inside, when other situation comes in favorable, like a stress, or like climate immediately changed, or you moved to a place where you are normally living, it's a very cold place, you moved to a very hot place, or sudden changes, sudden food change habit, you suddenly start drinking wine every day. So these sort of things, if you very patiently evaluate, you can see the seed was already there, but the favorable situation comes in favorable to manifest as a disease. How the seed in the soil gets a water and seasonal help to manifest as a disease. Autoimmune disease is part and parcel of our own seeds within us in a latent stage. We call in Sanskrit, it is Lina dosha. So I will explain a little more. So here, these 4 factors we consider as a plant to sprout from the soil. It required bija, means seed. It required a kshetra. Kshetra means the soil. And ampu means adequate water. Ritu means seasonal favorability. So these factors helps the seed to sprout out, even though it was present in the soil for many years. Hence, the Lina dosha is a state where the doshas are attached or concealed in dhatus, that 7 tissues. The symptoms in such conditions are least expressed or even not at all expressed. An Ayurvedic physician will be able to find out the future autoimmune disease which you are going to get maybe after a month or after 6 months. So that is a beauty. If you go to a modern doctor by suspecting that I may going to develop a psoriasis or I may going to develop a multiple sclerosis, he will say, no, you are mad. You never had a problem. You go back. When you have problem, you come to me, then only I can help. But the science Ayurveda, if the physician is well trained, he will be able to diagnose a futuristic multiple sclerosis or a futuristic psoriasis if he really look into the patient with a lot of details, his mental status, physical status. There are symptoms and signs explained for this Lina dosha, the seed, to find out whether the seed is in or not. So that is one thing which is unique to Ayurveda. Okay, we'll go to the next slide. The reason from which Lina avastha, how we are getting into this Lina avastha, that is most important. That's why I was telling you, this is very practical, what I'm going to explain you today. You all want to avoid this seed which is hidden inside you. So there are reasons I'm going to explain. Lapse in follow-up of daily and seasonal regimens. Lapse in the sense, you are having dinacharya and ritucharya. Dinacharya means daily routine one has to follow, and there are seasonal routines one has to follow. This has been very detailedly explained in Ayurveda, which may require a separate session for me to explain, but I can, nutshell, I can say in the future slides. Improper intake of pattern of food, like your eating pattern, that also I will explain you in the next coming slides. Unwholesome regimens, maybe diet or maybe exercise. And Vegana Rodhanam. In Sanskrit, Vegana Rodhanam means suppression of natural urges, which are mentioned, you have to avoid. That also I'm going to explain you in the future slides. And abstaining from the treatments. So if you are not taking appropriate treatment, you get some problem, you have some symptoms, but you are neglecting that. Okay, let me see later. I'm okay, I'm manageable. Never do that. You go to the right person and find out what exactly is going to happen in the future and prevent it. Frequent intake of suppressive therapies, which is very, very common, which is the fundamental reason of flaring up of these autoimmune diseases all over the globe. I consider this, if you have a fever, immediately taking a medicine to take care of this temperature. You have a vomiting, immediately taking a medicine to avoid this vomiting. You have diarrhea, immediately taking a medicine to prevent the diarrhea. These things will allow the body to hide the seed within them. So this is something I was talking you, Dinacharya, the daily regimens one has to follow. Ayurveda very clearly explaining you what time you are supposed to get up, what time you have to do the exercise, how much the quantity you have to exercise, what time you have to go to bed, and what are the things you have to do from brushing to shower and oil application, nostril medication, everything. If you follow this, there is less chance of getting into the trouble of this Lina dosha or hidden doshas. Ritucharya, as per Ayurveda, there are 6 ritus, 6 seasons. So every season, they have very clearly explained what to do, what should not be do, what to do, what not to be do. Everything has been explained. One who follows this Ritucharya also will have a benefit. Not the seeds will be getting hidden within you. Then this non-suppressible urges mentioned in Roga Anulpadaniyam. If you want to prevent the disease in the future, you should not frequently withhold or suppress these urges, natural urges like you have hunger, you are not eating, you have thirst, you are not drinking, you have you want to pass the flat test, you are not allowing it to pass, and urge to sleep, urge to cough, urge to sneeze. 1 or 2 times if you do, I won't say that immediately there is an autoimmune disease going to come, but frequently if you are doing, then there is more chance. So urge to breathe heavily on exertion, urge to cry if you are not crying, urge to vomit. If you frequently do that, you can develop skin disease, which we can personally, I have experienced in many cases. So these are something. And diet deviation mentioned in Ayurveda. Some tips only I'm taking, I'm not going to the deep. And one more things I want to explain you. I was showing you the tip of the iceberg in these things. So with this, I want to highlight that we are only seeing the symptoms and signs, which we are not practically looking into the depth of the tissues when we are getting an autoimmune disease. That is why purposefully I selected this slide with a photograph of tip of the iceberg. So coming back to this, Adhyasana means one type of eating habit. Eating before the previous food get digested is called Adhyasana. Like you had a little bit heavy breakfast at 10 o'clock. Then immediately at 12 o'clock, you are forced to eat again. Even though you are not hungry, you don't have a lightness of your abdomen, you don't have the burping, already you are burping and there is a smell of what we have already took. So that all indicate that that's not the time to eat again. And Vishamasana means eating a small quantity when you are too hungry, and eating more when you are not really having an hungry. That is called Vishamasana. So improper habits of eating. Samasana means eating conducive and non-conducive diet together. So somebody has asked, the physician asked you to eat only sweet fruits, but you are mixing the sweet fruit with sour fruits and eat together, then you will not get the benefit of these sweet fruits and you will get the harmful of the sour fruits, and mix it together, it will create more trouble. And another concept of Ayurveda is incompatible foods. So incompatibility is called as Viruddhahara. For example, you are not supposed to eat fish and milk. I am again repeating, one time if you eat, you will not get trouble. But so frequently we are eating, that, that imbalance will create, things will get hidden inside you. It can manifest a disease in the future. And honey with heated form. Heated honey so frequently we are not supposed to take. Cold substances in winter. Milk with banana or milk with any sour fruits, it is not advisable as per Ayurvedic understanding. Consuming cold water immediately after having hot tea or coffee, which is very common in our coffee shops in Zagreb. I personally witnessed, they will keep the coffee, parallelly they will keep the glass with water with ice cubes. And factors to be assessed while treating an autoimmune disease. We always have to assess these factors when we are treating an autoimmune disease, which are the humus involved, vata, pitta or kapha, and what status, what is the condition at the time when you are treating. The condition is so frequently changing. So you have to, certain situation, you may have to have a suppressive treatment also, which you may have to gulp a modern doctor's help. So the condition is very important. In a multiple sclerosis, in an acute phase, if you treat with Ayurveda, I won't recommend that. In a phase where things are under control, to prevent the further relapse, you may able to do that. And dhadus, which dhadus are affected, which tissues are affected, which place the patient belongs, what is the strength of the patient and what is the strength of the disease, both has to be assessed. And which season the patient got the issue, what is the digestive and metabolic capacity of the patient, what is the constitution of the patient, what is the age of the patient, and what mental strength the patient is having, most important, which I will explain you in the last slide. So with this, I want to conclude. It is very important to look at health and immunity from a holistic perspective, as opposed to looking it as a fragments. What is the problem with the modern sciences? It looks into the fragment, whereas we have to assess so many factors like the season, the tissues, and the person's mental capacity. So many factors which make the thing more holistic, and we will be able to help the people in a better way. Abnormality of immune system is only one of the aspects of the multiple interconnected pathological process that play a role in causation of so-called immunological diseases. So not merely one problem, it is an interconnection of so many factors. So you have to look at the diet, lifestyle, periodic panchakarma to cleanse. If you do panchakarma, like which my friend Nabosha will be explaining you, if you do so frequently this panchakarma, at least once or once in 2 years or once in 3 years, then this seeding of things getting stagnated inside will not be happening. And you have rejuvenative therapy. Herbs play a vital role in preventing many of them. Like you have free radical and antioxidants. That is some of the concept which is highly linked with the rejuvenation. Ayurvedic intervention comprising of all the above, along with the herbal medication and Ayurvedic therapeutic procedures, could be a very powerful alternative adjuvant to conventional medicine in immunological diseases. I'm not against to the conventional medicine. We have to get their help also, but taking care of this holistic approach of Ayurveda will heal the patients in a better way. So the last and final slide I would like to explain. So this is a new concept which you also may be aware, PNEI. PNE means psychological, neurological, endocrinological, and immunological. So here, nerve system, which we can roughly compare with Vata, endocrinological system, which we can roughly compare with the Pitta, immunological system, which can be roughly compared with the Kapha dosha. So all these axes, this is called PNEI axis. Modern medicine also now started accepting the most important role is manas, or the mind, or the emotion. So we believe, Ayurveda believe, a disease starts in the form of a thought. thought disturbs the vata, thought disturbs the pitta, thought disturbs the kapha, then you get all these. So most of our diseases in the current scenario linked with these systems, and we have to relook into an holistic approach to take care of ourselves. Thank you so much for your patient hearing. And if you have any questions, please do feel free to ask us through chat or email. Both of us email IDs are there, and we may try to answer once Nebosha's presentation also is getting over. And thank you so much.
Thank you, Dr. Biju. Thank you for your presentation. I know Dr. Biju for about a decade now, since I first went to his hospital, AV Arogya, for clinical practice. He comes quite often here. Unfortunately, we didn't see each other since last year. Maybe next year is the year to see. I will now stop your presentation and I will start with my presentation.
Okay.
You have here contact details of both of us. So if you have any questions or queries about this, it's a topic which is probably very deep and you cannot understand everything what we are talking about. But if you have specific questions about yourself, please ask us or chat in a chat available in Zoom. I'm gonna talk more about what's happening with autoimmune diseases, what's happening in our body. We all know that almost 10% of all diagnoses today are autoimmune diseases. There is around 80 diseases which we know which are qualified as autoimmune diseases today. This means that 1 in 11 persons have some sort of autoimmune disease. According to a study published in May this year in the Curious Journal of Medical Science, 80% of autoimmune diseases are females. So females have 80% of autoimmune diseases. Other studies put this between 75 and 85%. The big majority of all autoimmune diseases are females. And why is this happening? We'll try to talk about this now and try to see why are happening more to females. For example, females are 8 times more likely to have autoimmune disease than a breast cancer. The reasons are various, and stress is one of the reasons. Lifestyles, challenges, female place in society, many reasons. We cannot say that today's place, female place in society is worse than it was hundreds or thousands years ago. We have a positive stress, tolerable stress, and toxic stress. Stress is not so bad. Stress can be really positive for our body. Positive stress is a normal and essential part of healthy development. It could be characterized by brief increase in heart rate and mild elevations in hormonal levels. Some situations that may trigger a positive stress response are your first day at work, excitement. The stress is also can be tolerable. It activates body alert system to a greater degree as a result of more severe, long-lasting difficulties such as loss of a loved one, natural disaster, or receiving immunization, which is also stress for our body. There are also toxic stress. Toxic stress can occur when a child experiences strong and frequent physical or emotional abuse, chronic neglect, exposure to violence, also family economic hardship without adequate adult support. This kind of prolonged activation of the stress response system can disrupt the development of brain. So all in all, stress doesn't need to be so bad, but if we have stress which is prolonged, which is very tense, it's like tuning a guitar. If you tune the string or trying to pull too strong, it will break, and then problem can or doesn't have to happen, but it's problems can affect somewhere later in life. Then we have a second thing, it's microbiome of the body, which today we are talking about in the modern science. This is the biggest issue and the biggest research topic when we talk about autoimmune disease. We all know there are about 500 to 100 trillion human cells in our body, and they are formed from one cell, one zygote cell in a mother womb, which is actually divided in two, and from 2 to 4, for 4 to 8. The life cycle of a cell is normally from 12 hours to 120 days. Each cell in our body, from liver to brain and back to the gut, they all have the same genome. They have the same mind, the same intelligence. This intelligence is our doctor, our immune system. Mind is actually in every cell we have. In addition to our cells, we actually have a colony of other cells, actually 10 times more microbial cells than our own cell. So in fact, we are not complete without microbes, and they are much more adapted to life on Earth. They've been 3.5 billion of years longer than us on Earth. They are much more clever than us. They have donated their DNA to us. They are our friends. We are more them than us, actually. We are not family of sterile environment. When you look what we are doing now, sterilizing everything, and we have to think about what's happening to microbes in our body. What's happening with microbes when we sterilize hands every 5 minutes. How this affects our immune system. We are full of life in our digestive tract. The microbes process everything we eat. They synthesize vitamins, break down fibers, digest and release fatty acids. We need them in natural and balanced environment. And how we disturb this balance. For example, if we look at the problem of peptic ulcer was until 80s only cured by surgery. Then in 80s, a pill came along, anti-acidic pill, and tablets started to be used for peptic ulcer in the 80s, but not until Robin Warren and Barry Marshall actually found Helicobacter pylori in actually 1982, and this was in 1995 approved by FDA. It was approved that antibiotics can be used for peptic ulcer. And now, for the Helicobacter, we use 3 sets of antibiotics. 1 is not enough, 2 is not enough. So now the therapy is, common therapy is to use 3 sets of antibiotics. And how this is damaging our microbiome. It's true that discovery of antibiotics has saved millions of lives, and we are not trying to talk against antibiotics, but abuse and overuse of antibiotics also are responsible for many problems we have. If we continue like this, the germs will become our enemies, and what they need to defend, they will attack. So good bacteria, bad bacteria, all of them are needed in our body, and we have to make sure that we have good amount of good bacteria that can fight us and take care about our immunity. The third part of big reasons why autoimmune diseases are more female diseases than male is pregnancy. According to Melissa Wilson, author of a study at Arizona State University, reduced pregnancy rates. So for example, in the past, females from their puberty until their menopause, they were pregnant 10, 11, 12 times. In industrial society, means women's immune system is prone to changes. Reproductive power stays the same, but with female have 1 or 2 child, 3 the most. And this is, according to this study, could be one of the problems. The other problems about are hormonal therapies, contraceptive therapy, which chemicals stay in the body affecting the liver and immunity. If we had the impact of menopause for the females, which is also a great burden for them, when the regular cycle stops, all these toxins which were flushed out of the body, they stay in the body. And if females are not taking precaution about their health, regular rejuvenation and or cleansing of the toxins in any way, these toxins are usually bind for the fat soluble, they are bind for the tissues, and our intelligent body, they want to isolate them, and usually minerals from bones are trying to isolate them, and they lose minerals from bones and prone to osteoporosis. The body is intelligent, and it could deal with toxins, but we have to allow it with some normal and natural therapies. Another thing is testosterone levels, which protects men. It's very well known that females have only 10% of male level of testosterone, and testosterone by many studies could be one of the reasons why men are more protected for autoimmune diseases. There is another thing which is very important, and that's adverse drug reaction. Not many studies are done or researched how 2 or 3 or 5 different drugs react together when we put them in our body. If you take aspirin together with anti-acidic drugs, what's happening in the stomach, what's happening in the gut, we mostly research effect on one drug, very rarely few drugs, and we know that today adverse drug reaction is big burden. We start with drugs since our birth, actually. With vaccination, it's a small stress on our body. We usually get over it very easily, but stress stays, and if we stress our body too much, it will break at some point. Every single of these points, whatever the outcome, leaves an impact on the body. With the accumulation of the toxins which are not flushed out from the body that often, and this could also feel very frustrating for people if they don't know where this autoimmune disease is coming from, if they don't know the root of the problem, going from doctor to doctor, trying to find solution, cure. After few times failing in doing this, you're feeling like hitting the wall. So we have to go back to the nature, and the few most common autoimmune diseases are lupus, rheumatoid arthritis, Hashimoto, or hypothyroidism, or Graves' disease, hyperthyroidism, celiac disease, diabetes mellitus type 1, Sjögren syndrome, which is very common. It's when immune system goes after the glands that makes tears and saliva. It became very famous when Serena Williams withdrew from US Open in 2011 because of dry eyes. Most of these, interestingly, most of these autoimmune diseases present some early signs. Some early signs of autoimmune disease could be skin rashes, itchiness or flakiness of the skin, fatigue, rapid weight gain or loss, digestive tract issues, joint pain, bloating, lack of focus, abdominal pain. All these early signs early signs could indicate that there is some problems in the body. How Ayurveda looks at the autoimmune diseases? Ayurveda actually look at the really at the root and the causes, and the understanding from Ayurvedic point of view is that there are several ways why autoimmune diseases are starting to affect the body. First, we have to look at the causes. Causes could be genetics. And we know that about genetic, there is not much we can do. It's not modifiable. We are what we are. In fact, genetics is not such a big impact which affects our which affects our health and immunity. The biggest things are improper activity and rest, stress, unwholesome diet or wrong or unsuitable diet, exposure to toxic substances, and all these four causes are actually modifiable. We can do something about this. Improper activity or rest, if we actually sleep when it's not time for sleep, or if we don't follow the daily routine, if we stress, we have to de-stress. We have to find we have to find a way to let it go. Diet, really, that's something we can modify, and we can do something about it, as well as exposure to toxic substances. And as Dr. Biju rightly mentioned, it's not only if we do it once, if we do it twice, if it's continuing exposure to toxic substances, for example, alcohol, smoking, drugs, this will make a problem. If we continuously eating what we're not supposed to make it, this will affect our body. Ayurvedic interpretation of autoimmune disease, autoimmunity disorders, according to Ayurveda, are understood to be caused by toxins. And actually, these toxins are, we can divide toxins in Ayurveda and in any science in the toxins which are water soluble and toxins which are fat soluble. With water soluble toxins, we can do a lot. With water soluble toxins, we can fast, we can drink lots of hot drinks, we can eat proper seasonal food which suits to our body, and we can get rid of toxins which are water soluble. The biggest problem, according to Ayurveda, are toxins which are fat soluble. These fat soluble toxins, like stress, for example, like pesticide, herbicide, dioxin, heavy metals, these toxins are actually expelling in unique therapies in Ayurveda, but taking some non-saturated fat, which is going all the way to the cellular level and cleaning the toxin from the cellular level. The toxins are produced either through food that is not compatible with the individual or through the disease process resulting from dosha kopa, what was Dr. Biju talking. There is a growing body of evidence that suggests that intestinal bacterial toxins also to colon and the several food which are not compatible with our body can give autoimmune diseases like gluten or milk products, but this is really individual stuff. It's not that everybody doesn't need to take gluten or everybody needs to avoid milk products. It's individual, and Ayurveda looks at each problem on individual basis. For example, if you have an allergy or Hashimoto, each individual will be approached in a different way depending on their actual current condition, and in that way it will be tried to be cured. Ayurvedic approach with regular body cleansing, purifying, and proper food and diet aims to return regular and natural homeostasis of the body. And how would be this Ayurvedic approach to autoimmune disease? Firstly, balanced diet, lifestyle, and nutrition would be introduced. Then detoxification process. When the detox is done, correction on functional derangement at early stage. What does it mean? It means that that we would correct doshas in the body, de-stressing, rejuvenation, and Rasayana therapy would be involved. Detox process would be done in only if the toxins are at high intensity. So if we have, for example, mild intensity of toxins, and this is also very individual, where you would find out on consultation and direct contact with the client the level of toxins in the body, only food can be changed. So if there is mild intensity of toxins, changing of the food habits, introducing just food changes in diet could be done. If there is a moderate intensity of toxins, then food and herbs will be introduced. And if there is high intensity, Shodhana or Ayurvedic Panchakarma therapy could be introduced. This is ultimate solution, and always would be try at mild and moderate intensity to go just of food changing and daily habits and herbs introduction. What's happening in treatment principles? What's happening in Shodhana? Actually, we need to prepare the body for detox process. We need to prepare body by taking proper food before detox process, and I'm not going to go deep into the theory of panchakarma, but taking oils appropriate on a daily basis, which will actually saturate all toxins in the body, and then with the therapy we will expel these toxins. And there are 5 different therapies which are done for expelling the toxins. The Vamana therapy is induced medical vomiting. Virechana is purgation, and this is clearly says that the Vamana is mostly done for Kapha problems in the body. Virechana for Pitta problems, Basti or Enema for Vata problems. And Nasya is cleaning of the sinus system. Rakta Moksha is bloodletting. Even now, I think in Germany, they few years back, they doing lots of Rakta Moksha. There are few clinics open which do Rakta Moksha, but with leeches. After Panchakarma therapies, all these therapies are done together with massage, with relaxation of the body. So when we do detox, not only taking orally herbals, also our skin is our biggest organ, and through the skin we can introduce many good and bad stuff into our body. After detox, samana is on the so regulating of Kapha, Pitta, and Vata doshas in the body. So we need to really fine tune and find it's like tuning the radio station. So you really have to find real frequency of each person to harmonize them, to harmonize doshas in the body. And after harmonizing, Rasayana therapy starts with introduction of herbs, rejuvenation therapies, stress. Why then? Because once we expel all toxins, all channels are clear, and channels in the body could be channel blood circulation, could be lymph circulation, could be channel for the expelling the malas or expelling the waste from the body. When all these channels are clear, when absorption of the and power of absorption of the body is much stronger, and the herbs which we are taking and food which you are taking, it's much easier absorbed, and healing process, it's much easier to complete or to start. Here are the some of Rasayana herbs which are used in Ayurveda, and not only in Ayurveda, also in our herbal medicine. Tulasi is very widely used. Tulasi or basil, entire plant is used in Ayurveda. Benefits of Tulasi are various. We're not going to go deep into the what herbs are used for what, because this is again only very individual based. So aloe vera is Rasayana herbs, shatavari or Asparagus racemosus, which is a great herb for female health. Tinospora cordifolia, Amrita liguduci, it's a great immunomodulator. For all these herbs are very well researched on PubMed. You have many clinical studies which are actually done on these herbs. Celery seed, ashwagandha. Ashwagandha is probably the most researched herb from Ayurvedic medicine. It's used root. It's neurotonic and works really well in many occasions. It's herb which heats up in our cold winter. It's essential for lots of people here. Then we have a garden marigold, calendula, rosa canina, chamomile. There are many Rasayana herbs. Many more are not here, and we'll have one topic on Rasayana herbs somewhere soon, I hope. How we can cope with autoimmune disease? Once the cleansing of the body is done, we have to boost our system. We have to think about that. First, what we absorb, it's not food. First, what we absorb is oxygen, and breathing. Walking in the nature, breathing is very important. We can do it through pranayama, which can regulate these cycles, regulate circulation cycle. Pranayama can regulate heartbeats, take care of blood pressure. We have to follow these natural cycles, which are 24 hours. There is only one cycle which lasts 28 days, and mostly concerning females, and it's a gravitation force. We have to take a good water, which is the second thing what we absorb. So first we are breathing. The second is the water absorption, and then the third one is seasonal, local, organic fruits and vegetables. It's very important to eat seasonal stuff, not to eat outside the season, to eat local stuff, where the energy of the food is still strong. Organic stuff. Herbs have to be introduced to actually to help with digestion. And we have to think positively. We have to think to be compassionate with other people. We have to think about wellness opposite to illness. Less to be I, and more less this selfish attitude, and more to be we, and think about others, which will actually heal us. There are solutions also in integrated medicine to work together with Ayurveda. There is no science which doesn't change. So Western medicine is also a science, and like every science, it's changing. We should be open to other ideas and other solutions, and combining two, its way forward. Thank you all. If you have any questions, please, you are more welcome to ask them, or if you want to you can send them in chat if you have something specific. No questions. Oh, great. So you understood everything.
Okay. And they can even mail us. Our email ID is also there.
Yes. Okay. They can mail us. You have our contact. Thank you. I now figure out how to read the chat. Okay. Thanks. I know maybe not everybody understood in English, but we try to do it in English because it's easier for us and maybe for people who are listening. And if you need some translation, if you need anything, please contact me. And I'll try to, yes.
Maybe I can ask one question.
Oh, hello. Yes, please.
Vedran is here, yeah. I would like to know what about people who already had, mogu na hrvatskom?
Yes.
Da, ti prevedi poslije. Znači, šta je s ljudima koji su već operirali štitnu žlijezdu, eventualno uklonili i da li ima za njih nekakvih postupaka, procedura kojima se može pomoći, ne znam, mislim, govorili smo uglavnom o prevenciji, tako da šta je u slučaju kada je već došlo do toga da se žlijezda mora ukloniti, štitna žlijezda i slično.
Znači, postoperativna rehabilitacija i managing.
Da.
Yeah.
Da.
Okay, I will pass this also question to Dr. Biju. It's about when post-operative condition when there is a thyroid taken operated. So how we can manage the body immune system, hormonal levels, and basically how we can live day-to-day life.
Is it partial or complete thyroidectomy?
Complete.
Complete. Then I do believe we have to take the supplement in the form of chemical only. That is the best practical solution. I did not try to treat that cases Ayurvedically. Maybe it is little tough, but if somebody is really want to do that, we will be able to do some Rasayana drugs to experiment and come to a conclusion.
Okay. Yeah, I would just add to this, you know, if we're doing chemical therapy, or if continuing chemical therapy, everybody should think about doing a regular cleansing of the body. These chemicals stay in the body. They do functional stuff in the body, which is good. They assist the body, but they stay and damage some, you know, they help for the thyroid, for the hormonal levels, they help in this sense, but they are disturbing other functions of the body. So for these people who are taking hormonal therapies, regular cleansing is very important. So doesn't have to be panchakarma, doesn't have to be, but proper food, proper diet, proper rest to actually recuperate the body from the assistance of the chemical taken.
Okay,
well, correct.
Anything else? Okay, I would like to thank you all. I hope it was informative for you. If you have any further questions, please you're welcome to contact us, me or Dr. Biju directly. Dr. Biju.
Thank you all. I'm taking this opportunity to thank you all, and taking this opportunity wish you a Merry Christmas, which is coming very close, and a very good 2021. We lost the 2020 because of the pandemic, expecting a better year coming soon, and wish you all the best. Thank you.
Okay, thank you all.
Hvala puno.
Hvala puno.